welcome to another episode of Mental Health Matters. This is Tom Duff. I'm the Executive Director of St. Louis Counseling and a licensed clinical social worker, so I have the heart of a therapist and the mind of a businessman. I don't know about either of those, but anyway, it sounds good. But once again, we are here to have some conversation, talk about mental health, how mental health affects all aspects of society. It's just one form of our overall health. And so we'll get into talking about some specifics with military and veterans and active military. But I always put my plug in first. If you feel like, well, first of all, subscribe to our podcast, right? So make it easy on yourself. Download the podcast. Also become a subscriber. You can find it on our social media pages. And also, if you are curious about our services, look at stlouiscounseling.org. That's Saint spelled out, stlouiscounseling.org. And also, if you want to be a sponsor of the podcast, please reach out to Debbie Dugan, and that is D Dugan, DDUGAN at CCSTL, and she can help you maybe understand if you some of the details on how to be a sponsor. But as always, we try to help people realize how mental health is woven into our everyday worlds. We bring on intriguing guests, and today is no exception. We have Major Stephan Baker from the Missouri Army National Guard with us. How are you, Stephan?
Very well, very well. Happy to be here, and happy to see you again. It's been a while. So.
Yeah. So we were introduced several years back now, and we were able to partner with Missouri Army National Guard in regards to kind of helping out some of the active duty individuals with understanding, different aspects of mental health and stigma. Right. And so with this podcast, I'm like, I keep thinking, like, how can we get Major Baker on? How can we get Major Baker on? And right. I've just reached out, and boom, you were like, I'm in, let me help you. Okay. So
good.
I'm excited to have you on today. And so being able to talk military, be able to talk just some of the different issues that you guys face here and there. But, maybe a great place to start is when did you realize you wanted to go the route of military, and then what's some of that story?
And so what got me into the military, well, I was in law enforcement first to begin with. And then, of course, through law enforcement, you meet a lot of people. But my passion to help people, to resource people, to get into mental health probably came from law enforcement. So I wanted to continue my education in that realm, and I was in the National Guard anyway, so I decided to go active duty about 2006, active Guard Reserve, and from there I just kind of grew into the helping soldiers. It was a passion, loved the way it made me feel, and then as my education grew in Masters of Counseling, and then of course now working on a doctorate, and I got into family warrior support in about 2013, 2014. My career really started to take off after that, and it has been a wonderful experience so far. I'm sure we're going to talk about some things this morning.
Yeah.
It's just been a great road and great success in helping people, and not just that, but helping soldiers. So it's been great. So that's kind of the lead or the segue into how I got into the military, especially in the family warrior support arena.
Mm-hmm. So do you, from maybe help people understand a little bit that may not understand National Guard, right?
Sure.
So you're active in the sense that that's your full-time job, right?
Right.
But we also know there's people that do one weekend a month.
Right.
Yeah, so maybe explain a little bit of that.
So the engineering of it is that, I'm active Guard Reserve, but so the Missouri National Guard, most is made up of M-Day, what we call M-Day soldiers. So they attend 1 weekend a month and 14, 15 days out of the year. And so that is their mission. They contract, they have a military service obligation for so many years, but they go 1 weekend a month, whatever branch they're in, and they do their mission, they do their training, and then they do their 2 weeks of what they call annual training. So that is mostly what we're looking at. The full-time component of the Missouri Army National Guard is a lot smaller, but 9,300 9,300 folks or 9,300 soldiers in the Missouri Army National Guard, mostly as M-Day soldiers, mostly M-Day. When I say M-Day, and I apologize for the acronym. In the military, we acronym things a lot. In mental health, they do the same thing.
Yes, they do.
So you got to kind of really listen closely, but and I'll try not to acronym, but AGR is Active Guard Reserve, and that's what I am full-time. But a lot of things we're going to talk about, I guess, this morning allude to or point to treatment and resourcing of and helping M-Day soldiers. And not just that, we help everybody, but mostly it's M-Day soldiers. You're 1 weekend a month.
So why do you and I know we'll probably end up jumping around,
That's okay.
just because we have I think we'll have some good conversation.
That's all right.
So individuals that are coming in, right, 1 weekend a month, and then you have 14, 15 days throughout the year, right? But why do you think the National Guard wants to take care of those people with some of the programs you're involved in, right?
Well, just like everybody, so we want to take care of our own, and to do that, you have to understand the Missouri Army National Guard, just like other components, are based around readiness. It's all about readiness, and that is a complex mission. And for your soldier who has to, they have to leave their family, leave their loved ones, they have to deploy or mobilize or go off to some training, that takes quite a bit of readiness, and there's a lot that goes into it. There's physical readiness, there's training readiness, and there's mental health readiness. And the mental health aspect, in my opinion, is probably one of the most important, because it can be what the military calls, it can be a showstopper. It can be a barrier to that soldier meeting their mission and doing their training. And so I think we have done well, and I say we, and I got to say this, let me say this before we go any further. These are my opinions of successes that we've had and the programs that we've created, not expressly of the Army or the Missouri Army National Guard, but these are Stephan Baker's opinions, so I had to say that. But we have gotten better at producing programs that resource soldiers that seem to alleviate barriers to care. And what I mean by that is sometimes people, and you know this through your profession, sometimes people have a stigma or a fear of seeking, of pursuing help-seeking behavior. And so we don't want that. We want everybody, every soldier that has an incident or every soldier that has something problematic, to come forward and seek help. And as you well know, the faster they can do that, the better off I think things are. And so we got a lot smarter in creating programs.
So some of those prevention type programs,
educational type
at the
programs.
beginning,
Right. And I have to say, and Tom, we work together. I can't thank you enough and your team for helping us out when we created a program called the Substance Use Reduction Program. It's one of the programs that I created back in 2014, and it's going well. But it's great to have you all, resourcing and helping us out make that program successful. But back to the original question about resourcing. So it seems as if, and it might be for the civilian sector as well, but it seems like with soldiers, the faster you can provide a resource, the better off that soldier may be. And we're talking any problem that's addressed or brought to the surface and they want to speak to you about, the faster you can resource, I think just the better off they can be. So for example, we find out that soldiers in the Missouri Army National Guard and all over across all Guard states and territories, it seems to be like a lot of the problems happen in these categories. It's either maybe a substance abuse issue or a relationship issue or a work-related unemployment or underemployment issue or a financial issue. It seems to be in those categories, and you might have the same experience. But so we got smarter with saying, okay, since we see a lot of problems fall in these categories, let's see what we can do about creating some programs. So we finally got mental health on board, and they have been great. Name's Major Mark Fleming and Major Leftwich and the mental health crew and Dr. Fowkes and all that. They really have over the years really helped out, us tremendously in reaching out and developing those effective programs to touch soldiers, kind of like what I call platform programs. And so, right. So in 2013, we started to create. It seemed like the more programs, when I say programs, I mean stuff like program like substance use reduction program. Sometimes there's and the Army National Guard does very well, but sometimes you have a soldier that will test positive for a certain controlled substance, and they have to go through a process in the military. But we offered a program to say, okay, if these soldiers are struggling in a certain area, let's create a substance use reduction program of 1 week in a month, have them attend an 8-hour program on a Saturday of a drill weekend, and then let's see what the effect that has.
The data to support
Correct.
it.
So it's just like a regular, they're coming in to an intervention, and that's educational. Our interventions are educational programs. They conduct the 8-hour, they attend the 8-hour program, and then they come out, and then we kind of follow them. We have their commanders follow them very closely, and that's to see if what's going to happen after they attend this program. So it's kind of like we're looking at a lower, what they call a lower recidivism rate. We don't want them to recede back to risk-taking behavior. So that was one program that I created that was just, and others helped me out with it, that has been working quite well. And it gives a commander perspective. Once they go to the program, they're allowed to stay in the Guard for just a little bit. I mean, they're allowed to stay in the Guard, but they're watched very closely by their commanders, kind of like put on a probation kind of thing. And then it was very amazing, because what we were finding out with the substance use reduction program was that once they went through the program, if they were going to recede back to risk-taking behavior, they would usually do it within the first 6 months. After they got past that 6 to 8 month mark, they would kind of level out, and there seemed to be less problems. So the recidivism rate went way down.
Wow.
So I guess I explained that to you because that's one example of educational intervention, and then collecting the data, collecting the qualitative feedback from the soldiers while they're in the program, like what do you all need to be successful? But then on the other hand, looking at the numbers, and the recidivism rate is still declining to this day. So
that's awesome.
That's just one example.
Well, and what's cool about that is, well, I mean, there's several things, but one is you're giving people this intervention, this education, these new skills, right? And then yes, it's helping the Army out, National Guard out, right? But then they're taking that back into their personal lives and their work lives, which improves that integrated level of intervention. So you're actually helping improve communities in that regard as well too.
That's right.
But then it's also, I think it shows. So when you think about it from the outsider's perspective, they're like, oh, the military, very regimented, very black or white, and just the way it is. It's no change, right? And so it's kind of showing how you guys have realized, hey, wait a minute, maybe they can get a couple strikes, and we can keep working with them and help them out, depending on what the level of issue is.
And when you say strikes, so correct. It's the second chance. It's the psychology of offering a second chance to someone that I found out through talking to soldiers for years in this program, that they just love hey, we got a second chance with because they want to stay in the Guard and they want to do good things. They just kind of got off the beaten path a little bit. Now these are soldiers that go to the substance use reduction program that it's a one chance thing. So they've tested positive once, and then they get a chance to stay in, but there's usually no second or third chances. But this is a one-time second chance thing where just the idea of getting the ability or getting the opportunity to talk to somebody face to face about their problems, and then they go talk to mental health and they get one-on-one counseling, and they talk to me, of course, when I was a family warrior support. So it's just a great opportunity. It seems like a good networking system for soldiers to get a voice there. their frustrations and all that, and they take that back. Like you said, they take that back to their families. They take that back to their leadership, and those that are willing to stay, can become strong soldiers. They become good NCOs, and they have a story to tell. That, hey, I was at rock bottom one time, but I bounced back, which comes into a resilience factor thing.
Yeah.
And you both know about about the importance of resiliency, and that's what we try to do at Family Warrior Support. It's all about offering the components and development of resilience. And
so yeah, the family
warrior support.
Warrior support.
That's right.
Support. So explain what that a little bit of that is.
So Family Warrior Support, what they do is for better words, it's a lot of different sections and programs that offer resourcing. So, for example, you have the suicide prevention program manager. You have family programs. You have Citizen Soldier for Life. You have family assistance centers, SOS. You have the chaplaincy that works there as well. So, just for example, you have a lot of different sections of Family Warrior Support that offer a resource. And it's just like anything. It's like a hospital where a patient comes in and they have to be case managed, or even they go to a doctor's office, they have to be, there's going to be a case management type work with that person. You have to figure out what's the best resource to get this person back on track. And if I could say it that way, Family Warrior Support, that's exactly what they do.
Wow.
Is they come in, and when I came in, I created what's called the resource management team. We take a soldier that's having some problems, something problematic in their life or some issues, and we staff it. When I created that it's called the RMT, Resource Management Team. And see, I'm trying not to use
your acronyms. Yeah, exactly. You're breaking it down.
But just as in mental health, you all do the same thing.
Oh, we do.
Case management. You might call it something different, but same concept. Is we get the team together and say, okay, if this soldier's having problems with employment, then let's get them the employment resources. Let's find out where the jobs are located, what opportunities that's out there, so we can get the soldier a job. Because if that's the number one thing on the stress list, then that's the number one thing we need to address. It's a triage. It's a triage type thing, and you're familiar with that. You have to triage the stress to find out which one's causing the most psychological pain.
Yeah, peel back all those layers, right?
There it is. And so that's exactly what we did. And to this day, we still have the resource management team, what's called the RMT. And if it's a financial situation, a soldier might have a problem with paying bills for some reason. We don't have many of them, but we do have some that come forward and say, hey, I'm having problems with paying a bill, whatever. They apply to the Family Relief Fund. They put in their packet, and about 2 or 3 months they'll get a response back saying, okay, here's what we can give you some help in some financial areas, and that program works well. So those are two examples of number one, identifying what the problem is, getting the soldier in, or getting them, getting the mental health counseling, or getting the Family Warrior Support, and then finding out what resources is commensurate to their needs. If I could say it, that's probably the best way to say it, is you got to find out what resource or what problem solving skill is commensurate to their needs. And that could be it can be a short thing where that worked pretty well, and the soldier or the person never has any issues. Then again, it could be a long-term thing where they need to go see mental health and be referred outside to a therapist or mental health counseling, and that might be a longer-term treatment. Regardless, we track them. We keep track of them and try to continuously provide resources. And when I keep saying resources, that could mean a lot of different things. It just depends on what the problem presenting problem is. And I can sit here and talk for hours about that. You helped out with SERP. Substance Use Reduction Program. And you were part of that educational piece of, let me talk to you about stress. 10 soldiers in the classroom talking about stress and how to cope and how to develop some coping skills, and those things they add to the toolbox for a soldier.
Exactly. The toolbox is so important. And sometimes those toolboxes look different, based on from being a soldier to a private citizen. So sometimes they have to have those multiple tools because they're navigating different community systems or military systems.
Right.
But how? So stigma, right?
Right.
So stigma in general for mental health, it's out there everywhere, right? And so I
Right.
would think, and just from working with some of the individuals as well too, for them within the military saying, well, I don't want to tell because, I don't want to be perceived as, the word soldier, right? Says power, says like I'm control, or I can help. I don't want to seem weak, right? So I'm sure that's something you guys come up against. Or, I want to move up the ranks and I don't want to be seen as mentally weak, and I remember some of those things people have said. So how do you fight that? How do you try to get that message out?
So, so what? Let me. I'll back up a little bit, then I'll get to that question. So, anecdotal evidence started to come our way, which means that possibly there were soldiers that were coming forward that were saying, "Hey, we're not really confident in reporting. We're not really confident in pursuing help-seeking behavior." And so we thought it was out there a little bit. With every organization, it is. With every company, there's fear of reporting a critical incident or something that could be embarrassing. So what we did is I got with mental health, and we all got together as a team, sat down and kind of brainstormed and said, well, our senior leadership is interested in, is there really stigma, is there fear that is out there in our ranks? And if so, what can we do? And senior leadership at the time was like, let's get the answer. The only way to provide answers sometimes is to do a study. So we did in 2018, over a 3 or 4 month period, we did what's called a stigma study, using some different measurement tools and engaging tools. And the outcome of that study was there was a little bit of a presence of stigma in the ranks, and there were some demographics that came out, and there was some information that came out that was very helpful. And there was a presence of fear of soldiers not wanting to pursue help-seeking behavior because of the possible impact it could have on their career. And when you look at the research out there, and I know you study a lot of research as well as I do, when you look at the research out there, across all Guard states and territories, there's been a lot of studies, even active Army, Reserve, and Guard across the board. There's a lot of fear out there of soldiers not wanting to come to their leadership or go to their supervisor because of the embarrassment, shame, or the guilt that's attached to it. So they're like, I'd rather just not say anything because they're afraid they might not get promoted. They're afraid they may be they'll not be categorized or put off in an area where they're not able to grow in their career. So they're afraid. Bottom line is there's a stigma.
Yeah.
So once those stigma studies came out, which were very helpful, we started to address, and we're still addressing to this day, the different programs that we can either refine some of the programs, the existing programs that we have in resiliency, or we're in the process of creating new programs. So it was very interesting, and hopefully that I answered your question.
Oh yeah.
But there was stigma out there. There still probably is. But the good thing about Family Warrior Support and Missouri Army National Guard is we're on target with the problem, and it seems to be getting the problem being fear and lack of confidence with soldiers reporting incidents. It seems to be getting a lot better. So I can tell you, since 2014 or since 2013, we have continuously added educational programs like enhanced resilience programs, substance abuse reduction program, strong bonds for married couples or somebody in a relationship. And it seems like the more programs we have in the educational arena, our suicide incident reporting has gone up. Now, for those that, it may seem, what I just said, it may seem, well, if it's going up, that's bad. But the correlation is that they're feeling more confident in reporting.
Yeah.
So now we're getting those reports in, and we have more voluminous data in which to act from. And soon it's going to plateau. Soon it's going to go down, and you're going to see resiliency grow in the Missouri Army National Guard, and it is already. We have, and I can tell you, with the Missouri Army National Guard, we're one of the top states across the U.S. with readiness. We are one of the top states in ready to go anytime, anywhere, and deploy and mobilize. So that's because we have good mental health. We have a strong mental health program.
Well, and let me jump before I hit this subject.
Sure.
But with that, and like you said, the suicide rate, and that's so important that the suicide rate of reporting or the ideations,
Right.
reporting to that is so important, because so often we hear tragic stories, right? Either about a vet or anybody, right? Like, I had no idea. They kept that to themselves. There was all those thoughts that they just didn't know what to do with.
Right.
And so with that, that's great data to show, like, hey, we're getting more people to reveal those thoughts, which then means those interventions can take place, and then we're after it then, and we can be able to help in some level.
Perfect.
So that's exactly what we want,
Perfect.
With well, let me ask you this: what drives you to keep this moving forward?
Well, probably the same thing that drives you every day with mental health.
Yeah, I don't know. That's why I'm asking. No.
Okay, it could match. Maybe it doesn't.
Yeah.
We all have different motivators, right? I had a soldier come to me one time, and when I first came on as deputy chief of family warrior support, and this person's story was shocking, but it just seems like when people come and talk to me, it was a matter of by the time they come and talk to you, there's 1,000 things they're trying to juggle, and I felt like we have to do something. This is things don't get better. We have to start, getting smarter at resourcing soldiers. So I guess that was one of my motivators. But the other thing is it just makes me feel good to know that we're paying attention. We're out there continuously trying to save lives. And that's really what it comes down to, is all this work in studying the research, creating a program, making that program an intervention, and then studying the outcome or the effects of that intervention, such as the Enhanced Resilience Program, which is one of our top programs. We can talk about that later. Just to see the effects that it has and the positive effects that it has just makes me feel good. It makes me feel like we're making a difference. And so I guess that's really what drives me is just the ability to make a difference. And some of these programs that we've created have got National Guard Bureau attention, and now they're interested in, that seems to work pretty well for you, especially with protective factors study. So I guess I'll get back to your question. What drives me is just the ability to try to save lives, because as you know, the only thing standing between a soldier or a person and absolute psychological pain or self-harm is you. And that makes me feel good. Makes me feel like maybe this is good that we continue along these lines and we continually study the problem, just as you do in mental health.
Yeah.
You have to continually study the problem because things change.
Yeah.
Demographics and dynamics change.
Our society changes. Different
changes.
things like the onset of social media. That changed. I mean, that changed people, the way people think, the way people act, the way people date, communicate. I mean, so yeah, when society changes, we have to
Resiliency, the way they cope with stress.
Yeah.
Younger generation has a much different perspective than we do now, based on the way we were raised versus what they have now in social media and all the technology. And I do think that makes a big difference. We notice with the young people that some of their coping skills and some of their mental toughness, or what you call mental hardiness, is just not there. And it takes more resourcing for them than it would for you or I. So that I tell you, it drives me just the ability to affect change. That's really, if it's the number one thing I could say that motivates, affect change. And I'm currently taking on a doctoral program in which I graduate next year, and this program this doctoral program that I'm taking does just that. It teaches you to affect change. It teaches you how to, do the study, provide the interventions, collect the data, just like you do research. But then it also teaches you to, once you get that data, what are you going to do with it? Are you going to create something to make a difference? Or are you just going to sit on the data?
Yeah.
And, okay, well, it is what it is. I tend to think that, as you probably do too, is when you have the information at your fingertips, let's do something with it. And that's what we've done. And so I think we've been able to affect change in the Missouri Army National Guard with suicide prevention and intervention. I've seen it. I've seen it. I've been on the other end of a phone call with soldiers that say, hey, thank you very much for this or that. If it wasn't for that resource, or if it wasn't for you just calling me at 2 or 3 o'clock in the morning, I don't know what I would have done.
Yeah, impact.
Simple like that.
Yeah.
And you've had the same experience, I'm sure. So it makes me feel good. That's why I love mental health. I think I can sleep at night somewhat better.
Yeah.
Yeah.
So the stressors, okay, so we know stress in society affects us stress affects everything, our physical health, everything. And a lot of times when we think about veterans with the VA, and we see studies out there and things that happen, and even with soldiers, we always think about okay, stress, that must be, people just say that's PTSD because they were in combat, right? And there's so much more to it. And when you talk about the National Guard, right? I mean, what are the different types of stressors?
You're on it, Tom.
Okay.
You must have been reading or paying attention, because you're exactly
I had a good night's sleep every once in a while. Yeah.
You're right on the money with that.
Yeah.
That's right. That's
so
exactly right.
Maybe help people out there understand what is that world of stress that you guys experience.
So in the military, there's the stress of, like I said, the key word's readiness. At a moment's time, you have to be able to pick up, move out, leave your family. That creates a hardship. Or go train. That creates a hardship. And because you're separating yourself from your network of support. And if I had to do over again, I'd sign up again. I mean, I'm still, of course, serving and love the Missouri Army National Guard, but I would do the same thing. I love to serve, but it comes at a cost. And that cost is stress. And so, stress with soldiers is more in the line of, now you're talking, when I say the stress in relation to the Guard, it's M-Day. It's your soldiers that train 1 week in a month, 14 or 15 days out of a year, sometimes even more. They're called to pick up, they're called to a mission, to pick up, to mobilize, to deploy, and their life changes drastically from point A, living in living in their community and doing their job, civilian job, to going and living a different life. So from point A to point B, that changes drastically. Then they have to reintegrate themselves back into the civilian life. Whereas active duty, they might be going back. They might be going back to a post. They might be going back to an active duty installation, where your National Guardsmen have to go back to a community, and sometimes that plays a lot. That plays on a lot of stress. There's a lot of stress that is that occurs with them trying to reintegrate themselves back to that. And about reintegration, and that can be easy for some people, and that can be harder for some people. So when if you want to just talk along that one line of stress, where it becomes they have to pick up, go deploy, and come back and reintegrate, where the spouse has been doing everything while that person's gone, deployed. They've had to pay all the bills and do all the work, and they've had to do everything to keep the house running and the kids taken care of, and then the other person comes back, and now roles have to change back to where they were, and that can be stressful. And so that is the specific variable that we're dealing with when you're talking about the Missouri Army National Guard with M-Day soldiers. That's one lane of about 1,000 that I can talk to you.
I was going to say,
lane.
it's just one and that's something that I just don't think the general person understands or even thinks about.
That's a great conversation.
Well, and then the things that's flooding. It's not just packing sandbags, right?
Right.
I mean, you could be seeing people, and you're seeing community members in tears because they're watching their house flood. You're seeing bodies. You're seeing loss of pets. I mean, that's the thing I don't think we realize a lot of times, because we're like, oh, they're just helping.
And they have state emergency duty as well. Soldiers go on state emergency duty with all the flooding, and stuff that's been occurring, and that is another mission that they have to, leave their families for a while to go on as well. So that is true. Now, I know you alluded to some things about, like most people think PTSD and those things that people or soldiers can acquire. It's related to combat. And true to fact, there are cases out there. There are a percentage of them that do acquire post-traumatic stress disorder due to a traumatic incident. But when you look at the Missouri Army National Guard, and I think across most Guard states, it's mostly not combat that causes those kind of that causes post-traumatic stress. Let's just say post-traumatic stress, because there's a lot of there's a big difference between the stress and then the disorder, but with post-traumatic stress, so normally it comes from the categories that I talked to you about. Either there might be some financial stress going on in their life, there might be some relationship issues going on, unemployment or underemployment, and maybe substance abuse, or there might be other family issues that are going on, or things in their life that are going on that cause PTS. And over a long period of time, chronically, that weighs on a soldier's ability to be effective. And so that also adds to the stress. So that's why we try to teach resiliency. Hey, there's a problem. Let's identify it. Let's get into that self-compassion thing. Let's get into the awareness of the problem. Let's get into the mindfulness. And I know you've studied the mindfulness concept before. Let's get into the mindfulness part of the problem and see where we can go with solution-focused solving the issue. And it might take 1 month, it might take many months. But not getting off on a tangent, that seems to be, like those categories I talked to you about, that seems to be areas where soldiers struggle.
And if you can wrap around those soldier around those supports around those areas, there's going to be a better chance for success.
Sure. I mean, you just have to, if it's a relationship issue, a soldier comes and presents a relationship issue to their chain of command. Chain of command calls, to get them in for a mental health evaluation. Or they might call Family Warrior Support and say, hey, we need this person to go to the Strong Bonds program that occurs in the Lake of the Ozarks over a Friday, Saturday, and Sunday over a weekend, where you can sit down and the chaplains will talk to you, mental health will talk to you, and it's kind of like a little vacation also for the couple.
Wow.
And that's, like I said, that's an educational intervention. Let's see how they come out afterwards. I think that paradigm has been successful for the Missouri Army National Guard.
Wow.
It's been successful because you have to target the problem.
Yep.
You have to be somewhat on target, right?
Yeah.
So to say.
Yeah.
In your line of work, you have to be on target. And it's an investigation for the most part until you find out what the right resource is.
You mentioned protective factors as well too.
Studying that a lot. Right?
Yeah, and so that's pretty interesting. So a proactive way of trying to get in front of some problems, right? So maybe talk a little bit about what you're seeing with that.
Protective factors. So dug in heavily to the research on protective factors. It seems like people tend to respond better to discussion of positivity, positive psychology, self-compassion, and what we're now is protective factors. They seem to respond in a more healthy way than if I would sit here and tell you, let's talk about your suicidal risk factors. That might not be so good. That might not be the best approach for a person, because number one, you might spiral them back to re-experiencing something they don't really want to. They don't really want to go back, and they don't want to go back and think about that or experience it. But if you're looking at it from a positive perspective, it might be a lot easier for them to transition into what we call being able to tap into cognitive reserve, and that is let's teach them how to dig deep or dig down to find out what are some protective factors that keeps you from self-harm or that keeps you from suicide thoughts and behaviors. Let's work on that. So that's what I'm studying that right now pretty hard through my doctoral program, getting ready to enter into a capstone project where we're going to see how effective the enhanced resilience program is with RSP soldiers, with new soldiers and some other soldiers as well as a group. And we're going to see if where they're at with their where they're at with their protective factors. Are they low on the scale?
Mm-hmm.
Do they have the internal, external, and emotional stability that they should have? Are they low on that scale, or are they high? Where they, you're doing quite well, so you have a lot more resiliency than one that doesn't have a lot of protective factors in their toolbox, and so they're at a higher risk. So if I could throw this out, the inverse correlation is the more protective factors you have in your toolbox, the lower risk you are for suicide thoughts and behaviors. In the Missouri Army National Guard, what FWS is doing right now is trying to teach, in many different ways. They're trying to teach soldiers to be resilient to problems, where they can resource them, they can get them the resources they need, or they get them the help that they need so they can continue on with their mission. So protective factors is very interesting. When I read the research, I kind of did some self-reflection thinking, why didn't I look more at protective factors? Because it's not a new thing. It's been out since 2000. I mean, I think it got kind of big in 2008, where a lot of researchers were saying maybe we need to turn the tide and start looking this way.
Yeah, it's more asset-based than your weaknesses and stuff.
And so when you read all the stuff about it, a lot of professionals and such as you and researchers and doctors and stuff, they'll say, well, we're not getting the outcomes. We're not getting the outcomes that we expected from just identifying the risk factors. Like, your diet's not good. You have a family history, and by the way, you've had your brother or your sister or one of your loved ones had a suicide incident not too long ago, so you're more now at risk. So those are good things to look at, but those aren't getting when you use that as a treatment, when you use that as a foundation to treat the person, it might not get the outcome that you're not getting the outcomes they expected. So protective factors seems to be doing better, and they're looking at researchers want more studies. Let's turn the focus to what protects the person from self-harm, not so much what your risks are. Does that make sense?
Oh, yeah, totally. Because it even relates into young kids as well too. The more protective factors a child has, from birth on or inside the womb, the better chance of success. So, and at times, by time you guys get them in the National Guard, there could have been a lot of ups and downs in that person's life, and then what can you guys do to wrap again? And then, and I was having a conversation with somebody at work about some meetings we've been having as we're looking at some different change and trying to find some reasons to some of the problems we're having, and she was like, let's flip it and have this asset-based approach. And I'm like, oh yeah, because when she described it, I was like, oh yeah, we are very this is not going well, this is not going well. So it's like, well, what are we doing good, and how can we actually build that better on top of that?
Correct.
So totally, it makes sense.
Right.
Pretty cutting edge for you guys to be doing that within the military, if you think about that, right?
Well, yeah, in our mental health, like I said, our mental health division there, they know, they're well versed in, and as well as I am, in protective factors. They know how important they are. I just don't think some of the programs that we have in the Missouri Army National Guard, I think we're going to start developing more protective factors based programs, and they already exist. But like the Enhanced Resilience Program, I just want to
talk about that Enhanced Resilience Program.
The ERP. So that was something that started about 2014. We picked it off the ground. We put a conglomerate, well, it's not conglomerate, it's a cornucopia of programs together that deals with financial stability, relationship stuff, and then it has stuff about training, your benefits, what kind of benefits you can have, what kind of benefits you'll develop over time in your career. Just some real good resourcing programs, like 6 or 7 resourcing programs. And they talk about suicide prevention. They talk about substance use prevention. They're giving these soldiers all these programs. So it's over a weekend, Friday, Saturday, and a Sunday. So they start Friday, they come out Sunday, hopefully with and with all this knowledge, and then at the end of the ERP, what I call ERP, the Enhanced Resilience Program, they develop what's called a individual development plan, an IDP. just like in therapy.
Yeah, you got a treatment plan.
You have to put a plan in writing. And you have to make sure they're sticking to that, right, and they're following it. So, and then what the chaplaincy will do is they'll help them create that IDP, and then they'll follow them over a certain time to see if they're are they coming back on the radar screen with a problem? Are they coming up on the radar screen with a problem? Or are they doing well? And so what I'm going to do, the ERP is it's almost like everything that Family and Warrior Support has to offer in one package.
Wow.
And so that's why I'm like, okay, let's study that. Let's put a what we call the SRI 25, the Suicide Resilience Inventory -25. It's an inventory that measures when a soldier goes through that program, where do they rate on protective factors? Are they internally strong? Are they externally strong? And do they have the emotional stability? And do a pre-survey, then the ERP, and then the post-survey to see if they've learned anything, or if they're either higher on the scale or they're lower or they're the same. You got to kind of gauge where that's at. I know I got off on a tangent to get on the study, but it's so important to study your interventions, because if they're not hitting target, then you need to refine them.
Adjust,
right. And so the ERP's it's an amazing program. We've refined it over the years, and we keep refining it, but it's a really effective thing to do. It really works out pretty well. So we're going to know more soon about that. But the ERP's been around since 2013, 2014, and we have a new program that we've put into it now called Prime for Life. Have you ever heard of it? And that's some of the active duty components use Prime for Life, where it talks about suicide prevention, talks about substance abuse prevention, and stuff like that. So just once again, a lot of different programs wrapped into one package, where the soldiers sit down on a Friday, they go through the entire thing, they come out Sunday, and we hope that they come out stronger on the resilience end. And that is, we'll see you later, thank you for coming to the program. 3 months later, if there's something that happens, that they'll be able to resource, they retain what they learn. You know how important that is. If it's a financial situation, you know where to go to get help in the Missouri Army National Guard.
And exactly. You have that wraparound service of your people.
And relationships.
And that's the key to everything, right?
Relationships seem to be a top cause of issues. And you know how a lot of different things can come out of relationship problems. And so, that's, you have to address it. You have to address the stress and the resilience that, the stress that comes with that. So,
awesome.
Yeah. So the ERP is doing well, and we're going to see, we'll take a group of soldiers through in the next cycle that occurs, and we'll see where they're at, and then we'll refine the program, or we'll keep it the way that it is.
Yeah, because that's what it's all about, right? Is figuring out where people are at and where you guys need to adjust. So,
very, very much so.
Yeah. So amazing. So I hope people, kind of stayed with us and listened to this whole podcast. Sometimes I wonder how many people listen to me fully, but because you guys, I guess I can't give you guys credit enough for what you're doing. So one, you're serving our country, right?
Right.
So much we owe everyone in the military and every branch a thank you for that. Right. But at the same time, you guys are trying to build better people, not just better soldiers, not just better active duty personnel, right? Or even people are just doing 1 week in the year, getting deployed, or then 15 to 16 days during the year. Right. But you're building better people. And then those people are coming back into regular communities, regular society, and taking skills that you've helped them hone. And hopefully then they take that and then they teach somebody else. They're teaching their kids, they're teaching their spouses.
That's what we want.
So amazing work you guys are doing.
Right.
I'm so glad you're able to come on here today with us. And of course, with Major Stephan Baker.
Right,
these are all your opinions, right?
Right.
These are all what your beliefs and where we're at. But once again, thank you.
Yeah.
Thank you for coming on, and
Thanks
thank you for what you do.
Thanks for having me. I appreciate it. It's been a good time.
Awesome.
Yep.
I have a feeling we could have kept on for about 6 more hours,
Oh,
but we'd probably
most
need some
definitely.
more drinks and food
Almost
in
definitely. We
here.
can talk about this all day
Yeah,
long.
yeah, exactly. So I think we'll probably definitely have you on again. But once again, this has been Mental Health Matters. If you're interested in anything you heard, please feel free to reach out to me. Even if you have some questions for Major Baker, you can find me, and then I'll find Major Baker. And if you're curious about our services at St. Louis Counseling, go to stlouiscounseling.org, and you can find services anywhere you look. So once again, thank you, Major Baker.
Thank you for having me. I appreciate it. Thank you very much.
And until next time, this is Mental Health Matters.
This has been Mental Health Matters with Tom Duff of St. Louis Counseling Services. Check out stlouiscounseling.org for more information.